everyone, I hope you're doing well. I did put up a poll in my stories about who would like an IGTV on Dermapen, and the answer all round was definitely yes. So this is going to be my Dermapen IGTV. I'm going to obviously try to keep it short and sweet, but as in detailed as possible. But basically the aim of this is not only to educate you on what Dermapen is, but also what you should be looking out for in the professional world, as this is a specialized treatment. We are creating injury to the skin. We are working with needles. So there are certain standards and protocols that need to be in place for you to be receiving the best and most professional treatment. Okay, so firstly, I will do a brief description on what Dermapen is. Dermapen is very similar to your microneedling and your derma rollers. We are using small little pins, needles, to puncture the skin, and it creates a controlled injury to the skin. So the very important word here is controlled. And this is why it is very important for people to not buy these devices for themselves. You do see these YouTube videos where these girls go and butcher their skins, which is absolutely not correct at all. And should any extreme Dermapen treatments or microneedling treatments should rather be done by a doctor, not even a therapist. Okay, so controlled is the main word here. Is we are wanting to go in and create an injury to your skin to help accelerate that rejuvenation process, but we don't want to butcher or cause over inflammation. So the derma rollers and that you can buy from places like Environ, I know Lamel also sells. These are safe for home use. So what the difference is here is that the millimeters of the pins are standard across the whole roller. So and they're also very, very short. So you can get a professional roller that your therapist will use on your skin when you come for treatment, or you can get an at-home roller, which is obviously safer. The only disadvantage of the roller is it's kind of a very standard treatment. Because you've only got one size pin, you're getting one treatment across the whole face, where my skin on my forehead is very different to the skin on my cheeks, and my skin that is even textured is very different to my scarring. So the Dermapen is very cool in that sense that we can adjust our speed and we can adjust our depth, and every skin concern that you're treating has a safe and has a safe depth that you can work within. Okay, so Dermapen, as I said, is a controlled injury to the skin. So basically what we are doing is when the skin has an impairment, okay, you've got cells that you're born with, and when you are a baby, they're working at optimum level. I often think of this whenever Grace scratches herself, but literally either within the next few minutes or the next day, that scratch is completely gone. So what happens is, obviously, as we grow older, as we enter our different working environments, we've got certain internal and external factors that inhibit the way our cells work. And that's why our skin starts to age and starts to get dry and starts to have all these problems that it does have. So what is happening is that cell is now impaired, okay? And cells are continuously replicating. So if a cell is impaired and it's replicating, it's going to be replicating that exact same impaired cell. So when we use a Dermapen, we go in and we break down the cell completely, and it forces the skin to create a completely new healthy cell, and then that new healthy cell replicates, and you've got that full rejuvenation of your skin. So the science behind it is there. It links exactly back to what you would have learned in biology about the cells and about skin and all the rest. So yeah, this is basically science, and if you want to know if it works, it truly does. I'm going to keep it to that just to make sure that this video doesn't take too long. So if you do have any other questions, I will pop this IGTV into my stories with a question box, and then what I'll do is over the next few days, I will answer your Dermapen questions. Okay, so this would be your typical layout on your therapist's trolley. Sorry, I am just using a bar stool here because I am filming this at home. So this would normally be on my trolley. Just things to look out for. We've got a nice protective sheet here that will be changed between each client. Okay, and then we've got cleanser and basically a toner to prep the skin. I'm also going to use the new skin micellar water before I cleanse my skin. I haven't got that here out now, but I will show you in the video. So we're going to do a double cleanse to make sure the skin's super clean, and then we are going to also tone the skin just to make sure that there's no residue left on the skin. The next thing that you want to make sure is that your therapist has gloves, and it's obviously a new set of gloves per client. And then a hairnet to keep your hair out the way. And then I like to use these disposable face cloths, so I throw my cloths away after each client, especially when I'm doing these specialized treatments. I don't like to use sponges. So then the next step, what we'll do is we are going to use the Medi-Numb to numb the skin. I am going to decant this into here so that I'm not constantly putting my spatula back into the numbing agent. Okay, we leave the skin to numb, and then we needle with something that provides slip. So usually I would use my Lamel Soothe serum or the hydrating serum from this Anisi range, which I've actually finished. But today I'm going to use this lovely vitamin C meso serum from Mesostatic that was gifted to me to trial from Angeline. Okay, so that is what I'm going to use on my skin. The other things you want to look out for is a fresh cartridge. So this must be sealed. A new cartridge per person. And then I am going to use this syringe and needle to decant this Mesostatic serum, just purely because it's just the most efficient way to get this out effectively. I don't want to be pouring this onto my gloves because then I'm going to waste product. So I'm going to draw it out with the syringe. I'm not injecting anyone. I'm just going to draw it out, place it on the skin, spread it around, and then start my Derma Pen. And then the other very important thing is water. So I'm using clean water to cleanse the skin. Once I've applied my Medi-Numb, your therapist should be getting up and replacing the water. We don't want to use dirty water to wipe away the anesthetic. And then afterwards, once we're done with the microneedling, we put on a mask. The mask needs to be cleaned off with clean water yet again, because we have now got all these open channels going down to the skin, and then we've got our moisturizer. Let's move on to the treatments itself. So firstly, we want to have your client's hair out of their face. So I will be tying my hair up. A big difference with therapist treatments and GP treatments, not always, but sometimes, is your therapist will generally have more bedside manner, and even though it's not a very relaxing massagey treatment, they will try and make it as, excuse me, I'm going to look beautiful here, as on the therapeutic side as they can. Whereas your doctor generally, depending on who they are, if they're specializing in aesthetics, they probably will provide that you do have some comfort. But if they are just a general GP, they do generally want you in and out of their room, so they might skip the numbing process, and they're not really going to have that very let's cleanse your skin, and it's going to be a lot more frigid. But with the doctors, they are a lot they are allowed to work a lot deeper than we are. Okay. And you must always remember that. So if you've got a therapist that is going like cowboy on your skin, it's not safe. Rather leave that to a doctor who can maybe prescribe you with an antibiotic afterwards, or a strong topical cream afterwards to help with that inflammation, because if we get the skin over inflamed, we can actually aggravate what we are trying to treat. Okay, but anyway, moving on. I'm going to go in with a double cleanse, just because because we're needling the skin, I do want to make sure that my skin is completely clean. So I will be using our NutriCentrals micellar water. This is actually a new product that has launched in January. It is so divine. It is a 250 ml bottle, so it is just so worth the price. and it is a more professional, medically driven micellar water, so much better than your Garnier and all the rest. So basically I'm going to use this to remove my eye makeup. Okay, so I have cleansed with my micellar water. My next step is I'm going to use my cleanser, and then I'm going to also tone the skin. The toning is also just going to make sure that we've got any cleansing residue off the skin and making sure that we've got a really good clean canvas to work on. So I'm going to go ahead and do that. Okay, my next step is the numbing. Something very important here is at this stage, I don't generally have my gloves on. I like to only pop my gloves on once the needling starts, because then essentially I should be using 2 sets of gloves if I'm going to cleanse your skin with gloves, and then go ahead with the needling, because my gloves will then be contaminated. So I keep my gloves off right up until the point where I start to needle. So we have decanted the numbing agent, and then we are just going to nicely apply this all over the face. A lot of the time your lips can get very numb because they are very vascular. So we try and keep like a little diameter around the lips, unless someone is wanting you to microneedle their lips, someone who might be battling with hyperpigmentation on their lips, or just like very dry lips and they just want to give them a bit of an exfoliation. While I am waiting for my anesthetic to work, I'm going to pop my little syringe together. I'm going to open my little ampule that Angeline gave me, and I'm going to draw out enough for my treatment today. Okay, my next step is to then start preparing my Dermapen while we are waiting. So I'm going to open up the client's cartridge. I would actually have my gloves on now at this stage. I'll only do this just before we are ready to needle, so that I'm not touching other things, because also technically once your gloves are on, your therapist should not be picking up their phone during treatment and all the rest. It's gloves on and only touching the cartridge, the device, and your skin. So yeah, I am doing this obviously a little bit early now for my skin because I'm filming and it is my skin, but generally I will only start this process once I'm just about ready. So as you can see here, we've got a little button that starts it, and it almost goes like a little electric toothbrush, and I'll work on a speed of 3. I'll never go any faster than that. Doctors can go faster. We then move the depth on the dial over here. So generally for first treatments, I like to keep it between 0.25 and 0.5, especially if I don't know the person or their skin. If you have been coming to me for facials and peels, I might play around with 0.5, 0.75 on your first session. But we do generally like to keep it on the lower side, just to see how your skin reacts on that first session. And just remember, just because it's low does not mean that it's not working. It is still super beneficial. Okay, we then just clip the head on like that, and that basically pushes in and out and punctures the skin as we go. Okay, so my skin is feeling nice and numb. I am going to now pop on my gloves, roll my sleeves up, and we are going to go get started. I have refreshed my water. As I said, I want to use nice clean water to remove the anesthetic, and then we also don't remove the anesthetic off your whole face. We work up in sections. So I'm going to start on my chin and jaw, and I'm just going to wipe as I go. So that obviously just allows this section to continue numbing while we work. Okay, so the other thing that might prove a bit difficult is using the syringe on my face because I'm not lying down. So yeah, that might be a bit of a task, but we'll just see how it goes. So I'm going to remove from my chin and along my jawline, and my chin along my jawline. Okay, I can kind of generally see where I still have anesthetic. Okay, and then I'm going to go ahead and apply this without, there's actually some in the lid, so I'm going to start by trying to get that. I'm not going to get that out. Okay, so without injecting myself, I'm just going to shoot. Okay guys, this would generally be a lot more effective if my client was lying down, so please just remember that. So we're applying this and we're going to create some slip. I haven't had a Derma Pen in a while, but I do know my skin, so I'm going to start on a 0.5. Okay, so we are going to, we make sure that we're not only working up and down and horizontally, but we were also working diagonally. So as you can see, if you were to draw these dots onto a piece of paper, if you were to just work up and down and horizontally, there would still be a lot of gaps that you're not getting. So the diagonals just create more channels. You've got some nice little maskne scars there. So let's see how this rejuvenates. Okay. Okay, on my more meaty areas, I have bumped it up to a 0.75. Okay, so that is my full face done. The next step is I'm going to apply on a mask. The important thing to remember is, especially for the first 24 hours, anything that you apply to your skin after your Derma Pen, we want to try avoid very thick, creamy, oily products and stick more to like your more water-based and like gel consistency products, because we've got these little channels going down to the skin, so we don't want to clog them up with like these thick molecules that can then clog the skin up. So we want to do things that will effectively work its way down to the dermis through the channels. So this is a nice oxygenating gel, obviously with the blood flow that we've brought about here, putting something on that's going to supply oxygen to our blood cells and just go through the whole face is really going to liven and rejuvenate your skin. The gel consistency and the coolness of it is also just nice and soothing for after the treatment. So we are going to pop this on, and then we are going to let it do its magic for about like 10 minutes. And then remember, we are going to wash this off with clean water. Okay, so I'm going to now remove the mask. I do have a little bit of the vitamin C serum in the syringe, so I'm actually going to apply that onto my face before putting the moisturizer on, just to give it a bit more of a boost. But as you can see, the benefits of needling with the serum is, one, it's providing functionality of giving you that slip of the needle, but two, you're actually getting those ingredients, those active and concentrated ingredients of the serum right down to the dermis as the skin is being needled. Things to look out for with your Derma Pen. Obviously, for the next day, going into the evening, the day you've done your procedure, your skin is going to feel a little bit sensitive. It can go a little bit tight, and then also like almost like a sunburnt kind of feeling. Other things that could happen, you could experience a little bit of a breakout. That is generally expected, especially if your skin isn't used to such active ingredients. It's going to make the skin flare before it gets better. And then you can also get like a dryness, flakiness, similar to what you would see with a chemical peel. That's not always, but everyone's skin is different. So I am going to, simply because I am sitting upright, I would just apply this straight onto my client's face if they were lying down, but it's not working with the sitting up. So I'm going to secrete the rest of the serum onto my gloves, and I'm just going to pop it all over my face so that can seep down nicely everywhere. This does tingle a little bit. The hydrating serum wouldn't, but because this is a little bit more active, it's a vitamin C serum, it is tingling just slightly. And then I'm going to apply my moisturizer. So that is that, guys. I hope you enjoyed this IGTV on Dermapen. I hope you have found it informative, and yeah, if you have any questions, you are more than welcome to ask me. I will do a Q&A on my stories, and if you would like to have a skin analysis and maybe book yourself a course of these treatments, yeah, you're more than welcome to contact me. So yeah, this is my nice juicy red glowing butt skin. I will take a picture later in the day and just update you on what it's looking like. Thank you so much for tuning in, and I hope you have a great day.